One of the earliest and most telling signs that an elderly person may be approaching the final year of life is significant unintentional weight loss. It's often subtle at first, belts needing extra notches, clothes fitting more loosely, or a dinner plate returned still half full. Families often dismiss this change as a natural part of aging, but in truth, it's a critical signal from the body. When weight begins to drop without effort, it usually indicates deeper internal changes. The body might be struggling to absorb nutrients properly or process protein efficiently, leading to muscle wasting and a decline in energy. This kind of weight loss isn't just about physical appearance. It's a sign that the body's systems are slowing down. Appetite also shifts dramatically in this phase. The elderly often report food losing its flavor, meals becoming more of a chore, and hunger simply fading away. These are not just personal preferences. They reflect a physiological shift as the body prepares to shut down. In many cases, even serious underlying health issues like cancer or kidney disease may go unnoticed until the weight starts falling off. Families, in their love and concern, often respond by pushing more food or offering high-calorie supplements. But if the decline continues, it's important to recognize that it's not just about diet. It's about the body preparing for a transition. In these moments, forcing food may not help. What matters more is focusing on comfort, choosing easy-to-digest meals, ensuring hydration, and offering emotional support. A warm bowl of soup, a soft blanket, or gentle conversation might be more nourishing than a full plate. Recognizing this sign early allows families to shift their focus away from trying to fix and toward cherishing the time left. It's about making peace, holding hands, and being present. Because when the body whispers that the end is near, listening with compassion can make all the difference in how we walk with our loved ones on their final journey. One of the clearest and most impactful signs that a loved one may be entering their final year of life is persistent, extreme fatigue and weakness. This is not the usual tiredness that comes after a long day. It's a deep, lingering exhaustion that does not go away with rest. Tasks that were once routine, like getting out of bed, brushing hair, or walking across a room, suddenly feel overwhelming. For some, even holding a conversation or sitting up becomes too much. This kind of fatigue signals more than aging. It's the body's way of conserving energy as major systems begin to slow down. Circulation weakens, the heart pumps less efficiently, and muscles don't receive the same oxygen they once did. The body begins redirecting its limited resources away from movement and towards sustaining the most vital functions. This slowing down affects not only the physical body, but also the emotional and mental state. Many elderly individuals feel frustrated or ashamed by their sudden dependence on others. They might withdraw from conversations, stop participating in hobbies, or isolate themselves, not because they don't care, but because they simply lack the energy. This withdrawal can create a painful cycle. The less they do, the more they weaken, and the more isolated they become. For family members, this transformation can be difficult to witness. It's natural to want to encourage a loved one to stay active, to keep going, but forcing movement often backfires. Instead, it's important to recognize that this weakness is not laziness. It's a symptom of a deeper change. Offering comfort, respecting their limits, and creating a peaceful environment are far more valuable than pushing for activity. Now is the time to cherish small, quiet moments, holding a hand, sharing a memory, sitting together in silence. It's about presence, not productivity. If you notice this type of profound fatigue in your loved one, don't brush it off. See it for what it is, a meaningful sign that the body's entering its final phase. And use that knowledge not to fear what's coming, but to provide the support, love, and peace they deserve in the time they have left. One of the more heartbreaking yet telling signs that a person may be in the final year of life is increased cognitive confusion and emotional withdrawal. These changes are often subtle at first, a forgotten appointment here, a misplaced name there, but over time, they become more noticeable and concerning. A once sharp mind begins to falter, struggling to follow conversations, getting confused in familiar surroundings, or repeating questions and stories. While it may seem like normal aging, This cognitive decline is often linked to the brain receiving less oxygen and nutrients due to weakened circulation. Just as the body begins to slow down, so too does the mind. For loved ones, these moments can feel like a slow goodbye, watching someone you love drift in and out of clarity. Another aspect of this stage is emotional withdrawal. You may notice that someone who once loved chatting, laughing, or sharing stories now prefers to sit quietly, avoid social interaction, or even seems indifferent to things that once mattered to them. This is not a sign of disinterest or bitterness. It's a natural part of the body's and brain's winding down. The person may feel overwhelmed by too much stimulation or simply lack the energy to engage. Sometimes they appear unusually calm, while at other times they may be irritable or anxious. These shifts in mood and engagement are reflections of the internal changes happening within. For families, this stage can be emotionally taxing. It's painful to see a loved one disconnect or struggle to remember your name, but it's important to meet them where they are, rather than trying to bring them back to who they were. Gentle words, soft music, a familiar photo, or simply your presence can bring comfort even when conversations are no longer possible. This is a time to offer compassion over correction, patience over pressure. Your loved one may not respond the way they used to, but your love still reaches them. Understanding these changes not only helps you prepare for what's ahead, but it allows you to make the most of every remaining moment. By being present, by showing grace, and by offering the kind of connection that transcends words. One of the clearest and most concerning signs that a loved one may be nearing the final year of life is the onset of frequent infections and slow healing. While minor illnesses are common in older adults, a noticeable pattern of recurring infections, especially when paired with unusually long recovery times, can indicate a much deeper issue. The body's immune system weakens significantly in the later stages of life. What was once a robust defense mechanism becomes less responsive, leaving the individual vulnerable to conditions like urinary tract infections, pneumonia, skin infections, or even recurring colds that seem to linger far longer than expected. You may notice that cuts and bruises don't heal the way they used to. Even small scrapes can turn into chronic wounds or pressure sores, particularly in those who are less mobile. Poor circulation means that oxygen and nutrients aren't being delivered effectively to the skin and tissues, making even minor injuries a source of risk. And when healing slows down, the body's giving us a clear message. It's conserving energy, focusing only on the most essential functions. What's especially important to understand is that these infections may not always present in typical ways. Elderly individuals may not spike a fever or complain of pain. Instead, they may suddenly seem more tired, confused, or less responsive. Often, families miss these signs, thinking it's just part of aging. But in reality, it could be an early warning of the body's declining ability to fight off illness. For caregivers and family members, the natural instinct is to try to treat aggressively. Another round of antibiotics, another hospital visit. But in many cases, the goal should shift from curing to comforting. Helping your loved ones stay clean, well hydrated, and at ease can offer more benefit than medical intervention. Keep the skin moisturized, manage pressure points, and ensure they rest in a clean, peaceful environment. Recognizing these changes as part of the body's preparation for its final chapter allows you to make wiser choices, ones that focus on dignity, ease, and meaningful time together. The body knows what it's doing. Our role is to respond with love, presence, and deep compassion.
One of the most profound and often alarming signs that an elderly loved one may be nearing the final stage of life is the emergence of major changes in breathing and circulation. These changes can start subtly but gradually become more pronounced, signaling that the body is slowing down and prioritizing vital functions. You might notice that your loved one begins to breathe more shallowly or irregularly, perhaps pausing for long moments between breaths or alternating between deep, rapid breaths and long, slow ones. This pattern, often referred to as Cheney-Stokes respiration, is a natural part of the body's end-of-life transition and reflects the brain's shifting control over the breathing rhythm. In addition to changes in breath, circulation also begins to deteriorate. The body, recognizing its limited energy, starts redirecting blood to essential organs like the heart and brain, reducing flow to the extremities. As a result, hands, feet, and even the tip of the nose or ears may feel cold to the touch or appear pale, bluish, or mottled. These visible signs are the body's way of saying that its systems are conserving resources for only the most critical functions. Another key indicator is shortness of breath. Even with minimal activity, your loved one may become winded from simply sitting up, speaking, or shifting in bed. Lying flat might be uncomfortable, prompting them to sleep propped up with pillows or in a recliner to ease their breathing. You might also notice a persistent cough, gurgling in the chest, or an overall sense of tightness, sometimes caused by fluid buildup in the lungs as the heart weakens. As caregivers or family members, these changes can be emotionally distressing. The natural instinct is to worry or attempt to correct the breathing, but it's important to remember that this is a natural part of the body's final process. The most supportive response isn't necessarily medical, it's emotional. Providing a calm, quiet, and comforting environment, adjusting their position for better airflow, or simply being present can make a powerful difference. Ultimately, recognizing these respiratory and circulatory signs gives you the opportunity to shift focus from prolonging life to honoring it. It's a time to offer peace, not panic, to give presence, not pressure. In these final moments, the greatest gift we can give is comfort, dignity, and love. One of the most critical yet often overlooked indicators of an elderly person's overall health and longevity is their ability to cope with stress. After the age of 70, how a person handles emotional strain can profoundly influence their physical health, cognitive resilience, and quality of life. While younger people may bounce back quickly from stressful events, older adults often experience a much deeper toll. Prolonged stress weakens the immune system, disrupts sleep, raises blood pressure, and accelerates aging at a cellular level. In fact, chronic stress is linked to a higher risk of heart disease, depression, cognitive decline, and even premature death. Take, for example, two individuals, John and Richard, both 76 years old. John faces everyday challenges just like anyone else, but he approaches them with a calm mindset. He practices deep breathing, maintains a daily walking routine, and reaches out to friends regularly for conversation and laughter. In contrast, Richard internalizes his stress. He ruminates over problems he cannot control, isolates himself emotionally, and often feels overwhelmed by even minor frustrations. Over time, these patterns begin to manifest in Richard's health. His sleep deteriorates, his energy drops, and his blood pressure rises. Meanwhile, John continues to thrive both mentally and physically. What makes stress management such a powerful indicator of longevity is its cumulative impact. Emotional strain doesn't simply affect the mind, it sends signals to the entire body. Stress hormones like cortisol flood the system, increasing inflammation and wearing down critical bodily functions. But the good news is that managing stress is a skill that can be nurtured at any age. Simple practices like daily walks, journaling, meditation, or spending time in nature can provide significant relief. Even just talking to a friend or expressing gratitude before bed can help reframe the mind and soothe the heart. For older adults, developing emotional resilience isn't just about avoiding illness. It's about maintaining independence, enjoying meaningful relationships, and embracing each day with clarity and calm. If you notice a loved one struggling to cope, frequent worry, irritability, or emotional withdrawal, it may be time to step in with support and encouragement. Because at this stage in life, managing stress isn't just self-care, it's life-preserving care. Cultivating peace within can add not just years to life, but more importantly, life to those precious years. As we grow older, one of the most vital yet underrated pillars of health and longevity is social connection. After the age of 70, the strength of one's relationships often becomes a clearer predictor of long life than even diet or exercise. Human beings are wired for connection. Whether it's a weekly phone call with a sibling, morning coffee with a neighbor, or participating in a community group, these interactions serve as emotional nourishment, keeping the heart open, the mind engaged, and the spirit uplifted. In contrast, isolation and loneliness can have devastating effects. Studies have shown that chronic loneliness is as harmful to health as smoking 15 cigarettes a day. It increases the risk of depression, cognitive decline, heart disease, and premature death. Take, for example, two women, Eleanor and Barbara, both 78. Eleanor remains socially active. She attends a weekly book club, talks to her children regularly, and volunteers at the local church. Her days are filled with laughter, shared stories, and the feeling that she still matters. Barbara, on the other hand, has slowly withdrawn. After losing her husband, and with her children living far away, she rarely interacts with others. Though she watches TV and occasionally scrolls through social media, the lack of face-to-face connection has left her feeling invisible, forgotten, and increasingly anxious. This difference in social engagement has a ripple effect. Eleanor's mental health is stronger, her immune system more resilient, and her mood consistently more positive. Barbara, meanwhile, begins to struggle with low energy, brain fog, and a growing sense of hopelessness. What many don't realize is that social connection doesn't require a large group of friends. It only takes one or two meaningful relationships to provide support and purpose. For older adults, maintaining or rekindling relationships isn't just about combating boredom. It's a key factor in staying healthy and emotionally grounded. Whether it's reaching out to an old friend, joining a hobby group, or simply chatting with a neighbor during a walk, these small gestures build emotional security. And for those with mobility challenges, even regular phone calls or video chats can bridge the gap. In the end, it's not just about how long we live, but how loved, seen, and connected we feel along the way. A warm conversation, a shared memory, or the simple act of being heard can become the heartbeat of a long, meaningful life.
As life nears its final chapter, understanding and recognizing the signs of decline becomes an act of love, not fear. The final stage of life can bring overwhelming emotions for both the person going through it and their loved ones. But when we're informed, we can shift our focus from panic to peace, from trying to fix everything to simply being present. These months, sometimes even a full year before passing, aren't just about loss. They're a sacred opportunity. They offer a chance to show compassion, to create cherished memories, and to bring comfort and dignity to someone we love. It's in this time that families often realize how much presence matters. A hand to hold, a calm voice, a familiar touch. These things become more meaningful than any treatment or medicine. When we stop trying to make things how they used to be and instead accept where we are, we gain the clarity to provide exactly what's needed: reassurance, gentleness, and space for rest. As loved ones slow down, become quieter, or seem more distant, it's not always a signal to intervene, but often an invitation to simply be near, to share silence, to sit in stillness, to be a comforting presence without needing words. This stage also calls us to reevaluate what quality of life really means. It's no longer about productivity or independence. It's about comfort, peace, and love. It's about honoring the life someone has lived and walking with them, not ahead of them, through their final days. Whether it's helping with small daily needs, organizing meaningful visits, or just listening with patience, every gentle act becomes a part of their legacy. For caregivers and family members, knowing what to expect brings emotional strength. It helps shift fear into preparation and allows for intentional decisions. And for the person nearing the end, feeling safe, respected, and not alone can make all the difference. In the end, dying is a part of living, a deeply human process that calls for tenderness, not haste. When we embrace this stage with awareness and care, we create an environment where love lingers, even when words fade, and peace becomes the greatest gift we can offer. One of life's deepest lessons, especially in our later years, is understanding that time is precious, not just in the days we have, but in how we choose to spend them. As we grow older, we begin to see that health, connection, and a sense of purpose outweigh possessions or busy routines. The true wealth of aging lies in simple joys, meaningful conversations, shared memories, a hand to hold, or a quiet moment in peace. Many older adults have discovered, often through difficult experiences like declining health, loneliness, or life transitions, that our greatest strength lies in acceptance, not resistance. Whether it's recognizing when to slow down, embracing support, or letting go of what we cannot control, wisdom comes from knowing when to fight and when to surrender. Aging is not a loss of self, but an invitation to live with intention, to speak kindly, forgive freely, and love deeply. It's a reminder that dignity, respect, and presence matter more than ever. No moment is too small to matter. Each breath, each kind word, and each quiet act of care adds meaning to the days we have left. So live them with grace, guided not by fear, but by gratitude for all that was and all that still is.